In this video, we are going to cover the anatomy of the vertebrae. I'm going to try my best to keep things organized. My camera doesn't go back far enough, so I will have to kind of move things as necessary, but we'll make it work. So to start off with, your vertebrae is broken into sections, the cervical section, thoracic, and lumbar. When you're naming a vertebrae, you use the first letter of its section followed by its numerical order. So for example, this is the first one in the cervical section, so C1, all the way down to C7 because there are 7 cervical. There are 12 thoracic vertebrae, excuse me, and then 5 lumbar. A friend of mine told me it's kind of like breakfast, lunch, and dinner, 7 a.m., noon, 5 p.m. So if that helps you, fantastic. I personally like to think of 7 cervical plus 5 lumbar equals our 12 thoracic. But you do what works for you, all right? I mentioned that they're going to be named by the first letter of their section as well as their numerical order. However, the first 2 are just very special. They get their own names. The C1 is known as the atlas, okay? C2 being the axis. So we're going to talk about how these 2 work together in just a bit, but I want to focus on the atlas to start with. Okay. So here on the atlas, you can see we have these 2 masses on the left and right side, and they're kind of connected by these 2 bridges. Right? This front bridge that connects those 2 masses is called our anterior arch. Hopefully we can see those okay. And the bump that you see on this anterior arch is our anterior tubercle. Okay, so anterior arch, anterior tubercle. That's going to lead us to our lateral masses. And out to the sides, we have a couple features here. The extensions that are actually bone is going to be the transverse process. Remember, process is an extension of. And then you have these transverse foramen, which are these holes here. Now, the transverse foramen are only going to be found in the cervical section. Okay, the vertebral arteries are going to pass through here, so you have blood supply going to the brain. Your other sections will not have the transverse foramen. So if you happen to pick transverse foramen during your practical, you need to know that you are looking for the cervical section. Once we get past that section, we then have this bridge connecting our lateral masses towards the back. Okay, so this is the posterior arch. It is larger than the anterior. And there's a bump on this one as well, which is our posterior tubercle. Finally, what everything is surrounding is our vertebral foramen. Foramen, again, whole, vertebral. All of our vertebrae are going to have this opening. This is going to allow passage of our spinal cord through the vertebrae. Okay. Now, if we take this atlas and line it up with the axis, I'm going to bring back 2 more terms here. Our axis is C2, and you can see it has this protrusion here. This is called the dens. And when we line up the anterior arch and the dens, so the atlas and axis are lined up, this allows pivoting so that you can turn your head left and right. Okay. So the atlas is going to play a very important role because it's letting you turn left and right, but then these lateral masses here are going to line up with the occipital condyles of the skull and allow a forward and backwards motion so that you can nod yes and no. So we can nod with our occipital condyles on the lateral masses, and we can pivot around that dens so we can shake yes and no. All right. The last thing that I want to focus on, only in the cervical section, some of our vertebrae have a singular spinous process, so a projection off the back. But in the cervical section, so for example, here's a single, some of them are going to have two, and that's what we refer to as our bifid spinous process. So when we have two there, that's our bifid, and the only examples I have of these are in our cervical section. I'm going to switch gears, and we're going to focus on the ones that we can see in any of our regions. So I'm going to take out ones that are specific to cervical, atlas, and axis. And I'm going to put them in an order that I think kind of flows together. Okay. So I'm just going to pick just a random thoracic vertebrae. Okay, again, these are features that we can find on any of them. If you are holding the vertebrae, the spinous process should be pointing downward. Okay, so that's how we know that this is the superior side, this is the inferior side. Starting off, this large chunk is the body. And the body is going to connect to these side processes through these little bridges called pedicles. Okay, so the connections that go from the body to our transverse processes are our pedicles. And that brings me to the next term here, our transverse process. Transverse processes, these are going to stick out to the side. So remember the transverse plane, this is going to run in that plane. On either side of our transverse process in the superior and inferior direction, we have these articular processes. We have our superior articular process. Okay, so they are pointing upward. Hopefully we can see these okay. And then on the flip side, just kind of where the spinous process would be on either side, you can see it almost looks like somebody stuck their thumb or their fingerprint right in there. This is our inferior articular process. What happens is with each vertebrae, your superior articular process is going to articulate, okay, it's forming that joint with the inferior articular process of the one above. And so this is how we can get a little bit of mobility between our vertebrae. Okay, so superior articular processes are going upward, inferior are downward. From there, I'm then going to highlight this section here, these connections that are going from the transverse process to the spinous process called the lamina. Okay. Again, our spinous process, right? This is kind of the bump that you see if you bend forward on somebody's back. They check the alignment of these to check for scoliosis. And then, as I mentioned before, we need a passage for our spinal cord, so that's going to be the vertebral foramen. Again, these are structures you can find from C2 down through L5. Now there are two more though that I want to highlight that you will only find in the thoracic section, and that's the superior costal facets and the inferior costal facets. Costal is our term referring to the ribs. And at your thoracic region is where you're going to have rib attachment. So they will attach like this. And at the area where we're going to have that head of the rib kind of meet the body, we're going to have our costal vertebral ligaments. And you can see the corner of the body kind of slopes a little bit. So if we're looking at the top side, that sloping corner of the body is going to be our superior costal facet. The sloping corner of the body on the inferior side is going to be our inferior costal facet. And again, this is only in our thoracic section because that is where we are going to have our ribs.